Welcome back. We are joined now by Linda Julian from Coastal Carolina Hospital, who's going to share with us about a pertinent subject, infection prevention. Hi, Linda.
Hello.
I understand that this week, October 18th through 24th, is National Infection Control Week. Tell us why it's important to highlight infection control, especially from a healthcare or hospital perspective.
Well, infection prevention and control is really important every day, but this special week gives us a time to highlight hand hygiene, infection prevention, engage our patients, our visitors, our staff in fun activities to bump up the importance of hand hygiene and infection prevention.
Now, can you give some examples of common infections that people encounter?
Well, of course, we're coming into flu season. I think it's already started. So influenza, there are, of course, common enteric viruses such as diarrhea and vomiting coming up, and sometimes resistant organisms that are seen in the community. And we do precautions to prevent them or prevent the spread.
Now, what precautions can people take to help stop the spread of infections?
Well, of course, with the influenza, there is the vaccine. It is a vaccine-preventable disease. For everybody is eligible 6 months of age or older unless there's an allergy. And then the best thing that you can do is your hand hygiene, either with hand sanitizer or soap and water. If you have to touch your nose or your mouth, or if you need to cough or sneeze, you need to cough or sneeze in your elbow, not your hand. Of course, don't drink after each other in your home setting. That will spread the germs. Keep your environment clean, and with the diarrheal viruses, again, it's hand hygiene after you go to the restroom, before you eat or drink anything, and keep the environment clean.
Great. Now, at Coastal Carolina Hospital, what are some steps you are taking to help stop the spread of infections or to create awareness about infection control?
We have a visitor screening sign at all the doors, entrance doors, to ask the public, visitors coming in, to alert us if they're sick. If they have a fever and a cough, we ask that they not visit if possible. And to let the supervisor know, we have hand sanitizer dispensers in every patient room and throughout the corridors to encourage hand hygiene by everybody. We have signs in our patient rooms that let the patients know it's okay to ask the providers to wash their hands. And of course, we do a lot of hand hygiene training with our staff and promote hand hygiene, and we do isolation precautions when we know there is an infection.
Perfect. Linda, very informative. Thank you so much for being with us.